As I told quite a few of you in the pub last night, where I stayed probably later than I should have, that this is the first conference that I've spoke to fairly early on in my research based up at UWS in the west of Scotland. And I'm really, really pleased that I've chosen this as the first conference to speak at, because it's just been fantastic so far. And with Carl talking about, having courage and conviction. And right now, when we're here with all you guys, that just feels so easy, actually. And what I'm hoping is that I can hold on to that feeling and take it back with me and carry on with it. Because as we all probably know, that's much more difficult when we get back into the roles that we play and the different sort of challenges that we face with the people that we work with, and especially the conferences that we have to go to sometimes. It's really quite depressing, if I'm honest. So what I'm going to speak to you about today is just that one of the small studies that we've done at the Centre of Alcohol and Drug Studies in Paisley. And yeah, it's quite a small scale study and limited in nature, but I think some of the implications of it are quite important. So I'm hoping that you'll enjoy it. So as you can see, the focus was on public health nurses who work with drug-using women, and mothers in particular. And the reason why that became the focus of the study was through analysis of the Scottish governmental policies, primarily, which seem to be emphasising more and more the need to target parenting drug users. So this sort of focus seemed to evolve over the past 10 years, and it coincided with this new emphasis on recovery as being abstinence-based, published there, as you can see, in The Road to Recovery in 2008. And while this policy in particular sort of pays lip service to harm reduction, and it kind of touches on the nuance that's involved in definitions of recovery, at the same time, it really drives home the strategy of aiming for a drug-free society in Scotland, or in other words, basically the consumption of state-sponsored substances only. So we were interested in this focus on parenting drug users, and when we actually conducted a proper scientific literature review, it was quite astounding really to find that there's no real solid evidence, not only for the link between child neglect, which is a very emotive term, I'm sure you'll all agree, not only for the link between substance use and child neglect, but when you dig deeper, you also see that there's no real hard evidence for both the short and the long-term outcomes that are attributed to prenatal substance use, as Carol highlighted earlier. And what seems to be happening is, again, this misuse of science, which seems to be a bit of a theme today, but there's this mistaking correlation for causality, which I think is really, really important and something that we should all be aware of when we're accessing the scientific literature. And so, all in all, it's fair to say, the impact upon parenting capacity of substance use is fairly unclear as far as the science goes. But this doesn't seem to affect the policy, not in the least at all. And what you'll find is that we are looking again and again at this practice of there's a problematic extrapolation of treatment data. And so I think you'll all agree that the populations that are generally the focus of these studies are certainly not representative as far as the typical drug-using population goes. So going back to public health nursing, the reason we made them the focus of this study is, again, there seems to be more of an emphasis on their child protection responsibilities. And I think that's down to the fact that they are a universal service, being that they have access to all families. And so there seems to be a particular opportunity for surveillance in particular there. And that's not traditionally been the remit or the role of the public health nurse, which has over the years mostly been focused on health promotion and child development. But what we're seeing is a real role evolution now in terms of what public health nurses do. And that's led some to conceptualise them as the new social work. So certainly public health professionals are a key part in Scotland of the 21st century approach to problematic drug use, which made them interesting to us. So when I say us, I should say that Dr. Ian McPhee, who's also here today, also was involved in doing this study. So when I say us, that's what I mean. So the study that we done over the course of a few months last year it's qualitative in nature, and it was conducting really in-depth one-on-one interviews face-to-face with public health nurses who were interested in speaking about their experience of working with drug-using mothers. And the results were quite interesting. If you can have a look there, that's just some of the participant characteristics. A fair amount of experience, as you can see. So I'm just going to discuss a few of the main themes that seem to emerge from the data that we collected. And first of all, the one would be of engagement. And when I say engagement, the public health nurses that we spoke to consistently agreed that the engagement in terms of the relationship they had with mothers who were drug users in the service was very, very fragile, and they believed that this was partly due to the fact that there's a real atmosphere of fear and mistrust on part of the mothers because of the role evolution of them being more like social work in assessing and surveilling for the risk of child neglect. Then what happened is women are tending to withdraw from the contact that they previously got a lot of support from due to this fear of their children being removed from their care, which is a very real fear for them to have. But when I dug deeper through my conversations with the nurses, they seemed to have this idea, and it was reflected wider in the literature, the very small amount of literature that exists on the subject too. And that's basically that, this notion of a chaotic life that stems inevitably from drug use, it results in them not being able to be a responsible parent and keep up the appointments that are in the interest of their child. So there seemed to be this idea that it was due to drug use that the problem with engagement was, whilst recognising this atmosphere of fear and mistrust, they didn't attribute the lack of engagement to that fear and mistrust. They directly attributed it to this sort of behaviour that's perceived to come from the drug use. So what I've tried to display here is the sort of cyclical reasoning that's going on, because when they try to intervene, what seems to happen is when the women retreat and there's no compliance, then for them that sort of justifies the need for the intervention, and it just keeps on growing from there. So the other main issue that was mostly consistent throughout the sample was the lack of training that the nurses had to deal with drug use. What was interesting for me is quite a few times when I asked, so what training do you have that equips you to deal with drug users? And they all said, well, child protection. I found that quite interesting. It kind of gave an insight into the lens through which they were approaching drug use. Some of the quotes here that I've got, and you could see, when I prodded them further, but what about specifically on drug use and the whole spectrum of issues that are related to it, not just the harms, which of course are very important, but the social processes that we are all inevitably caught up in of stigma and demonisation. And it's being aware of this, I think, is something that could be very useful for public health professionals. So you could see they were saying, the influences of drug and alcohol, I don't think you get enough information. And when I asked them what sort of information do you feel would be helpful, the idea was that all they really had to know was, the names of drugs and the drugs that people were using, and not much else. So basically what happened is that I think through the lack of training and from the way that they are forced to operate on the Scottish governmental policies, which really hammer home this child protection agenda, is that they approach drug use. And when I say drug use, the questions I was asking were not just about problematic drug use or the severe end of the spectrum, but it was drug use in a very general sense. And so what I was able to do was come up with a few key points about what I believed was their perception of the related risks. And my conclusion was essentially that the perception of risk does, as I had expected, reflect these dominant narratives of drug use. where the addiction inevitably results in a loss of control, which had consequences for not only their ability to parent effectively, but also it affected what they defined as being recovery, which, as a consequence of viewing addiction as a loss of control and inevitably leading to death and destruction, then it lends weight that the recovery surely had to be abstinence. And with that, what I think is very important to remember is that if recovery is abstinence, then any continued drug use, no matter what effort is made on part of the mother to minimise or reduce harm to the child, in the nurse's mind, the continued drug use signals danger, and it's something that has to be addressed. Yeah, just another couple of quotes to illustrate the point. The drug use takes over, is all they think about. That idea was very common. And they want to stop it. They can't. The pull is just too strong. Now that also legitimised their understanding of recovery as being abstinence-focused, but it also in a way legitimised the need for their intervention. They can't stop it on their own. They need us, they need help, they need services, and many people do. But in actual fact, one of the things that we could be teaching in some of the more critical training programmes that are much needed is that there's a whole range of people who deem themselves to have overcome problems with drugs and alcohol, and they've done it either on their own or in many different ways, and I think that needs to be acknowledged. So continuing on with the main theme of risk perception of the nurses, as soon as, Carl had said earlier on that, you're so reserved, you guys, and we need to get more enraged. Well, I have to say that, when I was asking these questions in particular more directly about what do you believe about drug using women and their ability to parent, I have to say it took all my strength to hide the rage that I felt. It was just such an injustice and so discriminatory, some of the comments. As you can see there, I have to say a minority of them were fair enough, and they were given the policy line of we have to be non-judgmental, and maybe a recognition about the complexity. But on the whole, I have to say it was quite shocking, and the view that drug use makes you a bad mother was very much apparent. They will say, but we're never here when we have our whatever. And she said, like that is okay. But at some point that will escalate, won't it? And what that reflects is actually I was shocked to hear that these nurses still perceived a real risk to the child's well-being, even when the actual drug use was taking place when the child was maybe under the care of a responsible family member. So there seemed to be an effort on the part of the mother to minimise the risk by really planning their periods of intoxication, leaving the child with a sister or a mother. But even in such instances, the public health nurses being affected by this dominant narrative that addiction is inevitable through exposure, they believed, that's not good enough, because at some point they won't be able to plan or manage their intoxication, and it will inevitably end in chaos. So some of the conclusions that I made from doing this study, which I found really interesting, and it's been on to influence some of the work that I hope to do in the future, is essentially that this new focus on child protection, this pushing forward in Scotland of the child protection agenda, it's a good thing, and I'm not suggesting that we shouldn't make effort to look after our children and make sure that they're given the best possible start in life. But I think there's real consequences for focusing too much on child protection to the expense of the harms that's caused by these policies. So it should be about looking at the family as a whole and recognising that by taking good care of the mother and by fostering a trusting relationship, then by extension the child's get a greater chance of having a better experience in life. So what I've suggested is that is this problem of engagement, which has been reported elsewhere in the literature, I don't think it is to do with the fact that drug using mothers are irresponsible, as I'm sure you would agree. I think what we should focus on is the way that the health professionals are perhaps unwittingly having an effect on this by further eroding the already fragile trust. And I think this marginalisation of harm reduction values is very, very dangerous, and I think as we see it going on, it's only going to get worse. So essentially, it's a moral crusade against drug use, and it's depriving women of a lot of really vulnerable women at that, a really valuable source of support. Well, I know myself from my own experience that it's been great to have a good relationship with a health visitor, that just someone to bounce back some questions you may have about parenting. But the minute that woman is known as a drug user, then all the interaction becomes very focused around the drug use to the exclusion of other important issues. So the recommendations that I'd be making on the basis of this study are that we need to try and give training to non-specialists who are increasingly involved with the care of drug-using women and their children. We need to not only teach them about the risks related to drug and alcohol use, we should also assist them to facilitate some kind of critical self-reflection, and it's something we should all do. Certainly to think about, do I have any views that I need to reassess, and how does that impact upon my practice on a day-to-day basis? And it seems quite obvious, but it's obviously something that's lacking. So professional practice should reflect the evidence base about drug-related risk, and not political and moral frameworks, which unfortunately is what it seems to do. Again, when I say evidence-based, then we'd have to be really, really critical about that, as we've heard over and over again about the way science is being systematically misused to support policy. So of course, these are small measures, and they're recommended on the context and the current climate that we're in. What we really need is to start dismantling prohibition. But in the meantime, while we still have this climate, I think these small things should definitely, there should be an effort here to recognise that the way we're dealing with this problem is only making it worse. And again, what I hope to do is some of the further research that will examine not only the role of professionals in the construction of social problems, but research which really makes an effort to extend into the wider population of drug users instead of this myopic focus. And sometimes it is due to what's really, really easy for researchers to do. It's easy to access drug-using women who are already in treatment services. They're known. There's not much for them to lose, especially women who may have already suffered the punishment of losing their children. But what I would suggest is that this focusing on hidden populations is one way that we can really start to challenge these oppressive dominant narratives about drug use, and hopefully start to treat women in the fairer, just way that they deserve. So thanks for listening to me today, guys.